Hi guys, today we're going to do an NG tube insertion. So this here is Miss Molly Huggins. She is a 75-year-old female, okay? So let's just imagine she's an elderly woman, okay? Because we're not gonna deal with a pediatric insertion here. Knock knock. Hi Miss Huggins, my name is Tanya. I'm going to be your nurse today. So I'm going to do hand hygiene first. How are you, Miss Huggins? Are you doing okay?
My tummy hurts.
Oh, your tummy hurts? I'm so sorry. So, Dr. Butterfly told me that you have been having issues with your stomach and wants me to do an NG tube insertion. That is a tiny tube that goes into your nose all the way down into your stomach to help take some of those contents out. Have you been vomiting?
Yes.
Do you know what kind of contents came out?
I'm throwing up blood.
Oh, you're throwing up blood. Oh my God. Well, that NG tube that we're going to put in most definitely will help with that. We're going to hook it up to suction and it will help relieve some of that pressure and also some of that blood that is in that stomach, okay? So have you had any kind of recent surgeries in your nose or for your stomach?
No.
No? Okay, good. Do you have any polyps in your nose?
No.
No. Any esophageal varices?
No.
Okay, very good. So if she had said yes to any of these, then we as registered nurses were not able to go ahead and put any NG tubes in. That is contraindicated, and then the physician would have to go ahead and do that. All right, so let's make sure that we do have all of our supplies besides the physician order for the NG tube insertion. So for our insertion, we do need lubrication. Normally you do have those one-time packets of sterile lube, right? You have seen those in the hospital before. Because it's a mannequin, I'm going to use silicone oil, and that's fine. I'm also going to have some paper tape just to put to secure the tube on the nose, bridge of the nose, once we have inserted it, before we permanently put it on the nose, bridge of the nose. Then we do have an irrigation tray with piston syringe. Okay, it is closed still. I do have a Sharpie so I can mark where it's at. We would also have those pH strips that unfortunately I do not have. However, that would be my first indicator whether or not I am in the stomach for gastric secretions. And then based on what we're doing with our NG tube, because we're suctioning out, I'm going to use a Salem sump. It's a double lumen stomach tube, for example. It has the regular tube, and it also has this blue little thing right here, which is my air vent, okay? So just in case if it was on the side of the stomach, I can instill a little bit of air and then it releases itself from the stomach. Because it is a tiny mannequin, I'm going to insert this tiny tube, okay? However, it does work the exact same way. All right. Here I am, Miss Huggins. I'm going to measure my tube first. The way I am going to measure is from your tip of the nose to your earlobe, all the way down to your xiphoid process. Okay, once I have measured, I am going to ask you to pretend you're going to drink a sip of coffee or water just to make the tube pass easier. Okay.
Yes.
I'm not going to give you anything to drink because if you do have blood in your stomach and I'm going to give you anything to drink, it actually could make you vomit more or get you more nauseous and sick. So that's counterproductive. Okay, so we're trying to get you better. All right, so let me go ahead and prepare all of my materials over here. I'm opening this here up. I do have my piston syringe right here, and right inside I also do have a tiny part that is going to make sure that at the end of my tube nothing is going to come out. So I'm going to leave this in here. I already have one tape ready to go then to secure the tube on the bridge of my nose. I'm just going to rip it in halfway so we can attach it nicely. Okay, so this is all ready. So here we go. Taking my first NG tube right here, and as you can tell, there are several markings on here. Okay, so I would go ahead and put a towel across her chest just in case if she starts gagging and vomiting, because we have to get past the gag reflex. Okay, so let me go ahead and cover your chest here a little bit. I'm going to just measure, okay? I haven't inserted anything yet. Here we go. From the tip of your nose to the earlobe. And now going all the way down to the xiphoid process. So there is luckily already a marking right here. Otherwise, I would have used my Sharpie to make a marking. Okay. So that's how far I need to go to be in the stomach. Okay. Or hopefully be in the stomach. Now I'm going to take my lubricant. And I'm going to spray all that lubricant all over because we want to be kind to our patient. The more lubricant, the better. And don't be afraid if she starts gagging, that is quite normal, okay? Here we go. We're nice and generous. All right, Miss Huggins. What I'm gonna do is I'm going to help you move your head forward while I'm trying to insert it at first, okay? It might feel a little uncomfortable because what that does is it's going to close off your windpipe so I can get into the food pipe first, okay? We don't want to go into the lungs with that feeding tube right here. That is going to suck out all of that extra blood. I'm going to help you with that. Once we're past the uncomfortable part, it will make it much easier thereafter. Now I will let you know when it's time for you to pretend swallow that water, okay? So feel my hand touch you at the back of your neck. Here we go. We're gonna lean forward a little bit. Okay, Miss Huggins, feel me touch. Okay. I'm sorry. Go ahead and pretend swallow. A big swallow here. Go ahead. Swallow, swallow, swallow. And just keep on inserting, okay? Because once it is in and she has started to cough and gag, that is the time that you continue to insert. That's the gag reflex. Okay, there you go. So we have inserted all the way into the stomach. We're past that point. We actually got it in to the point where my marking is. If there is a lot of pressure in the stomach, you should already see return of potentially that blood that she was talking about. So make sure to clamp it right away. Take your piston syringe, put it in the end, and withdraw. Clamp it again, and put it on your strip to ensure that this is indeed in the stomach, okay? Now we get to close it off with our little tab that we had ready, right? And keep it above the shoulder, above the stomach most definitely. Secure it on the bridge of the nose. So the split So you have the regular part on top of the bridge of the nose, and the bottom part, sorry, Miss Huggins, I know it's not pleasant, wraps around the bottom of the tube. The gold standard for our NG tube insertions is still the chest x-ray. Okay, we do not instill any kind of air because we don't know where we're at. Even though we see blood coming out, it could very well be that she has any damage in her lungs. If it is actually just to suction out anything from the stomach, we can hook it up to light intermittent suctioning. However, we would never just go ahead and instill any medications or anything else until we have the chest x-ray confirm that the NG tube has successfully been placed in the stomach. Okay, Ms. Huggins, how do you feel? Do you have any pain or discomfort at this time?
No.
Okay, very good. So they're taking a chest x-ray off your stomach and off your chest right now. Once we get those back, we'll let you know. Okay, I'm gonna hook it up lightly to the suction, and that should give you some relief. Okay, always keep the head of the bed greater than 30 degrees just to facilitate the motility and also to prevent any kind of aspiration. Okay, and that is all there is to NG tube.